All right, Kilmany Dukart, thanks so much for the latest. We appreciate it.
So the Biden administration maintains that Dr. Kevin Kennard, a neurologist, has only seen the president during his annual physicals, but that's not all. They say Dr. Kennard has held various clinics at the White House, especially for military personnel, and that's why he's been there so often.
But I thought if you're actually serving in the military, obviously you could not have any sort of movement disorder or otherwise, like Parkinson's. So that's,
and why would you be doing it repeatedly at the White House?
Yeah, seems a little odd. No, but obviously we're not buying it. Are you buying it? Are American voters buying it? This is the administration's spin that keeps going on. And will this letter from the president do anything to quell the nation's fears? All right, and joining us now to discuss, congressional candidate from Arizona and president of the Jasser Center for Comprehensive Care, Dr. Zuhdi Jasser. Dr. Jasser, thank you so much for joining us. I think today everybody wants to speak to a medical professional here from the anchor desk, because we're thinking, what is going on? Because we all know, again, I am not a physician. And once you hear, though, that a Parkinson's expert has visited the White House 8 times in 8 months, then you hear the administration's take on things. It does seem like things don't add up. And another layer to that, doctor, just because the White House and perhaps the president's doctor is saying that he does not have Parkinson's, that certainly doesn't rule out any other sorts of cognitive challenges, say like dementia. Your thoughts?
Yeah, absolutely. And I have to tell you, I think the Parkinson's specialist is a bit of a head fake, in that they knew, a serious head fake this time. They knew that this was going to come up, and they picked a specialist of a condition that's related to, as you said, movement disorder. Patients with Parkinson's present with bradykinesia, slowing down, cogwheeling, tremors. He has none of that. That can be obvious to anybody that looks, and yet is a very specialized neurologist that can then evaluate other aspects that wouldn't then be on the White House rolls, as somebody specializes in a memory clinic, dementia clinic, et cetera. And I can tell you, having practiced for 30 years in primary care, this is a very common condition. Millions upon millions of Americans suffer from cognitive impairment, suffer from senile degeneration of the brain. And, listen, we deal with families in conference and talk to them about the capacity of their loved ones. Do they have capacity to make their own decisions, et cetera? But again, we're not talking about capacity to decide whether you're going to use a microwave or use a stove. This is the most penultimate executive decision maker in the planet, which is the President of the United States, the Commander in Chief. So just as I, as a physician, when I see another physician, I have a duty to report. I have a duty to the public that when I let him or her out of my office, they're not going to hurt other patients as surgeons or hurt other people on the road as drivers. And and as a military doc, I used to make a similar decision-making process when I'd clear people for duty. So his physician, Dr. O'Connor, and others are lying to the American public if we don't really know exactly. This didn't happen overnight. This happened slowly. So what we saw on the debate stage, what we've been seeing before our eyes, you don't need to be a neurologist to know, and yet the cover-up, the lies continue.
Well, the old saying goes, when there's smoke, there's fire. And I truly believe that is kind of what's going on right now. I want the audience to know Dr. Kennard is like one of the world's specialists in this field. Dr. Jasser, why, in your words, I want to hear, if he's not there to see Biden, what would he be doing so much at the White House? Someone so specific in his field, he probably is dealing with patients, complicated cases all the time. Why would he be at the White House so much if he's not there for a specific reason?
Yeah, I wouldn't know. I mean, I think ultimately you're right. Odds are he is making an assessment at the White House and, meeting with Dr. O'Connor and seeing the president as a patient. But the bottom line is that it allows the president to have some confidentiality where he sees a doctor for Parkinson's and it's not related to dementia or memory care. And ultimately they can continue to gaslight us with the specialty and not being related to the primary diagnosis. Because remember, as a primary care doc, when I refer a patient, I don't know the diagnosis. I'm referring them to somebody who can then make an assessment. Well, Dr. Kennard is a Parkinson doctor, specialist, well-known internationally, but he works very closely with other areas. And there is, at the end stage of Parkinson's, patients can have end-stage Parkinson's-related dementia. So he certainly is versed in the subspecialty evaluation of dementia and cognitive impairment, and thus can bring to bear other specialists in his departments or in nearby departments at his neurology department, so that they can make similar assessments at the bedside and in the White House.
Yeah, I have no doubt that Karine Jean-Pierre, again, is going to have to answer questions about this throughout the press conference today, as we see on the right-hand side of the screen there. We're waiting for her to come out and continue to have to explain what in the world is going on with Joe Biden in the White House. Dr. Zuhdi Jasser, thanks for coming on.
Anytime. Thank you.
Well, we do